The discomfort of rheumatoid arthritis can pose many challenges, and my goal as a physician is to help you improve your life. This self-care guide is full of important lessons that you can practice at home, or you can take it with you to maximize your comfort anywhere in the world. Let's begin.
Rheumatologistoncall.com.
Rheumatoid arthritis is one of the most common autoimmune diseases that I see in my practice, Rheumatologist on Call. Besides the fact that it can affect more females compared to men, the main complaint that my patients will tell me about is pain and being very tired or very fatigued. And being tired will affect equally men and women. So here are my advices for taking care of yourself at home. Number 1, nutrition. The number one thing that I teach my patients is that food that you eat matters. Yes, what you eat will affect how you feel with rheumatoid arthritis. If you are following my YouTube channel, you know that I talk a lot about the foods that you should avoid and foods that you should incorporate into your diet. Foods that contain omega-3 fatty acids like fish, nuts, seeds, and olive oil have been shown to fight inflammation. Fruits and vegetables high in antioxidants such as berries, spinach, broccoli, legumes, and whole grains are also great to support your gut health. Replace salt with a lot of spices like turmeric, garlic, and ginger, which can also have a lot of anti-inflammatory properties. Incorporate lots of probiotic foods like yogurt, kimchi, or kombucha that will also improve the gut microbiome. Drink plenty of water. And don't forget to remove the inflammatory foods like fried foods, processed carbs, and added sugars. Number 2, exercise. The second thing that I teach my patients is to engage in exercise. I know there is a fear, a misconception that exercise might damage your joints, but this is just a myth. This is not true. I know what you will say. If you hurt, you can exercise, and I believe you. But I do not want you to run a marathon. I do not want you to run a mile. What I'm telling you and what I'm telling my patients is that you should try to walk for at least 10 minutes every day. This is all you need in the beginning. And in time, you can increase this period to 15 minutes, then 20 minutes, and eventually to 30 minutes a day. I know it's going to take time, but it is the best thing that you can do for your joints. I encourage my patients to do a lot of exercises in the water, aquatics, and preferably aquatics in the warm water is the best thing for people with rheumatoid arthritis. You can also try yoga, stretching, and other low-impact exercises that will help you improve and will maintain your joints' mobility and strength, because exercise is great to release endorphins that will also make you feel better and will decrease the pain. Number 3, hot versus cold therapy. Another common recommendation that I make to my patients is to use hot and cold therapy. Alternating hot and cold therapy offers a simple but also an effective relief for patients with rheumatoid arthritis. Heat will increase the blood flow, will relax your muscles, and will loosen up your stiff joints. Warm showers, baths, heating pads, or hot packs can help you move better. Now, sauna, like infrared sauna, is also a great option for people with rheumatoid arthritis. Now, when to apply cold therapy? You can also try to apply cold therapy when you have joint pain. What will cold therapy do? It will numb the nerve endings and will reduce inflammation in the swollen joints. You may try to wrap ice packs in a towel or try to use cold gel packs, but be aware that you should not keep them in direct contact with your skin for more than 5 to 10 minutes. Number 4, assisted devices for hands and feet. Don't be afraid to use assisted devices. Splints, braces, compression gloves, kitchen tools like jar openers, door openers can be great to help you in your day-to-day life. I actually have 2 videos about very useful assistive devices for the hands and feet in my YouTube channel, so please feel free to check them out. In the description of these videos, you also find a lot of links to the products that I present to you, and if you want, you should try them. Number 5, learn to say no and prioritize rest. What do I mean by this? I mean to listen to your body. We all want to complete 10,000 tasks every day, but when you suffer with rheumatoid arthritis, you might need to really make a list of priorities. So that is why I teach my patients to learn to say no. Do not feel ashamed to say, I cannot do this today, because this is not on my priority list. When you feel in pain, you should rest. When you feel tired, you should also take a break. If you have a busy day, then take some short breaks regularly throughout the day. If you need to use your hands repetitively, like typing a lot, it is important to take breaks and let your hands rest. Number 6, prioritize your sleep. Sleep and pain have a bidirectional relationship, and if you sleep less, you will hurt more. So my advice is to prioritize getting 8 to 9 hours of sleep every night to allow your joints to recover. And here is a video that will give you 7 tips about how to sleep better. Number 7, practice mind-body techniques. Meditation, deep breathing exercises like square breathing exercises will promote relaxation and reduce stress and pain in people with rheumatoid arthritis. I have a video where you will find 10 tips that will help you decrease the stress and pain using mindfulness. You can also try these positive affirmations that I put together in this video. Number 8, use massage for your sore joints. Massage stimulates circulation around painful joints, and it will increase blood flow and relaxes surrounding muscles. My recommendation is to find a professional massage therapist experienced enough to work with people with arthritis. Number 9, quit smoking. Rheumatoid arthritis patients must quit smoking. There are many studies that will show that smoking actually worsens inflammation and may actually trigger the development of rheumatoid arthritis in some people that are genetically predisposed. People that smoke also have an increased disease activity. So more disease, more pain, more inflammation, and it will react differently with reduced effectiveness to rheumatoid arthritis medications. Number 10, find the right support team. You are not alone. There are millions of people experiencing rheumatoid arthritis. Join a support group, and you can even consider to join my Facebook group, which is called Rheumatoid Arthritis Warriors Group, where you will share your success, or you can share your hurdles and learn from others like you. Find a rheumatologist who can help you understand and respect your wishes and be part of your team, not against you. Your rheumatologist should teach you about the disease, have a comprehensive view of your nutrition, mind, and body needs, and it should treat you like a person, not a patient with a disease. You should be able to build trusting and respectful relationship with your physician and feel comfortable in this relationship. If you need help, you can consider to contact my telemedicine practice, Rheumatologist on Call, that is able to see patients in multiple U.S. states. We do offer prompt, affordable, and high-quality medical consultations from the comfort of your home. Now, let me know in the comments below, how are you managing your rheumatoid arthritis at home? Do you have any tips? Do you have any tricks for other people with rheumatoid arthritis that you can share here? If you find this video helpful, don't forget to like, share, and subscribe to my channel to support my educational mission. Until the next time, don't forget to take great care of you.
Rheumatologistoncall.com